All eyes are on the Senate as healthcare reform makes its way through Congress. And America, you're riled up about this topic, like really riled up. Case in point, Family Research Council President Tony Perkins, and listen to these pointed words. He said, as a nation, we are without excuse in paying for abortion on demand in Obamacare and subsidizing Planned Parenthoods. Gruesome trafficking of baby body parts. I look forward to even more pro-life gains under the Trump administration. The other side, Marian Endelman, the president of the Children's Defense Fund, said this un-American and unjust act to repeal the Affordable Care Act strips away affordable health insurance for tens of millions of newly insured Americans. It threatens current health care coverage in place for 95% of all children in America. Does this Republican-led Congress and White House really want to be the first Congress and administration in history to take away health coverage from the most vulnerable Americans amongst us? Well, joining me from Danbury, Connecticut is John Patrick. He's the author of Health Attitude: Unraveling and Solving the Complexities of Healthcare. John, thank you for joining me.
Yeah, it's nice to be here.
You were saying earlier to me that we're treating the symptoms of a broken healthcare system, but not the root of the problem. Tell me about that.
Yeah, well, the real problem in healthcare in America is the cost of delivering that healthcare. There are many other issues, such as pre-existing conditions and premiums and deductibles, and there's a long list. But the big one, the really big problem is our healthcare is too expensive. And that's what ripples through and causes all these other effects. We spend 50 to 100% more per person than other developed countries in the world, and we do not get better health care as a result.
Let me stop you there, because I think that when the average person hears that, they immediately say, okay, yes, we know that healthcare costs a lot of money, and I'll get to the why in a minute, but are you saying that there's a possible way to do away with healthcare or health insurance altogether?
Absolutely not. Everybody should have health insurance, everybody. But the problem is the cost is so high that you can't fit the 20 pounds into a 10-pound bag. That's the problem. And we spend so much more than these other countries, and we don't get better care as a result. We spend over $1 trillion more than we need to for unnecessary tests and procedures. And that squeezes out the ability to deliver really needy healthcare services to other people. We have a really old, inefficient system. It's full of fraud. It has poor quality. We rank 43rd in life expectancy in the world. Thousands of people die in our hospitals from mistakes and infections. We can do a lot better with the system as a whole, and that would make it better for everybody.
Okay, so let's talk answers. You're suggesting that instead of focusing on health insurance, lawmakers should be setting limits on the cost of, are we talking about like setting limits on the cost of a heart transplant, for example?
Not necessarily setting limits, but setting fixed reimbursements for hospitals and doctors. So, for example, a hospital in Atlanta may negotiate a contract with Medicare or Aetna or Blue Cross or Cigna to say, okay, for $700 a month per person in the Atlanta zip code, we will provide health care for that group of people. So let's say seniors, people over 65 in Atlanta, $700 a month. Now, with that kind of a model, business model, hospitals start to look at, well, maybe we don't need to do these extra tests. Maybe we don't need to do this. Maybe we don't need to do that. We're still going to be measured on the quality of care we deliver, but we don't necessarily have to overdo it, which in many cases is what we do, and that drives up the cost for everybody.
Right, and so listen, I get it. I get if you lower the cost altogether in this equation, then costs are going to go down across the board. Paying for healthcare is going to be more manageable. Paying for insurance as a result is going to be more manageable, even if you have a pre-existing condition. But my question to you is, this is not even on the table. We are talking about simply fixing insurance right now. Is there anything that can happen right now, in your opinion, to even get this ball rolling?
Well, the Senate just started, and they made it very clear they were starting from scratch. So we really don't know what they're going to come up with, but a lot of people in this country, including in the Senate, recognize that we have a big cost problem, and it has to be addressed. The insurance and the deductibles are just a manifestation of that high cost. So when people say we're taking away affordable care, we don't have affordable care.
I get the point.
We don't have it. A lot of young people have a few children at home, and they both work, and their family deductible is $12,000. What kind of health care is that? And others at the very low income level, yeah, they have a card that says I have insurance, but try to find a doctor that will accept that card.
Right.
So we don't really have what we say we have in affordable care. We do not have affordable care. That is the problem.
John, are you encouraging then constituents? Because I mean, we are talking about stuff happening right now. You know, we're well beyond just this idealistic discussion. So are we saying right now we need to get constituents? We need to get on the phone with our senators and say, let's rewrite this thing with the focus on cost?
Absolutely. We should be demanding of Congress to intervene over the cost of drugs. That industry is completely unregulated. Government doesn't need to set the prices. They just need to let Medicare, which is like 75% of our healthcare system, negotiate the price of the drugs they pay for. Medication costs are bankrupting families across America. It's incredible how much we spend for things, in many cases, which don't really do us any good. Meanwhile, we get carpet bombed with 15 ads on the TV every day for things that are not going to improve our health, and in many cases for drugs that are not even effective.
So a little bit of process here. Do you think that if something passed the Senate, that once it got to conference, there would be any chance of it getting to the White House and not vetoed?
Oh, absolutely. Yeah, the president has already said that he wants to allow Medicare to negotiate. A lot of people have said it, but nobody has actually done anything about it. Now is the time to take the action, and I hope that the Senate steps up to it. I don't see how they could not step up to it. The lobbying is intensely strong from that industry, but the people's voice is beginning to be heard, and everybody knows that the cost of drugs is a major, major problem.
Very good, John. Well, thank you for joining me. A very good point, and the action point is now. The time to act is now. Thank you, John.
Now, you're welcome.